Welcome back, and a little later we shall take you to Parliament, where the appointments, that special appointments committee, the committee that has been set up to investigate the chaos that marred last Thursday appointment vetting committee. We shall bring you all the updates as our correspondent is on standby. Kuku Asante will bring us all the details. Please stay with us. However, first off, Parliament has directed the Ghana Health Service to take immediate action to bring the outbreak of cerebrospinal meningitis under control. CSM has so far claimed 14 lives in Upper West region alone. We'll hear from some members of Parliament shortly. But first, let's take you to the Ashanti region, which recorded 42 cases of meningitis in 2024, representing more than 100% increase from the 18 cases recorded in 2023. Sadly, one person died from this ailment. Here is Clinton Yeboah's report.
Meningitis has become a serious and potentially fatal disease in Ghana and is endemic in the regions of the north. The outbreak in the Upper West region saw 10 deaths out of 42 cases in 2024. The Upper West region's outbreak had a high fatality rate of approximately 23.81% compared to the Ashanti region in 2024. Despite the severity disparities of meningitis, cases in Ashanti region continue to rise. Ashanti Regional Director of Health Services, Dr. Fred Adumaku-Boateng, highlighted the underlying environmental and demographic causes of the diseases.
Well, sadly, we're unable to bring you that, but we'll bring you details of that and would expand on that conversation. But responding to the surge in cases, Minority Chief Whip Frank Annoh-Dompreh demanded that the Ghana Health Service be brought to Parliament to answer questions.
I came to this shores of this country and told us that we must make institutions work in this country. So we don't have the Minister of Health sworn in, but we have the Ghana Health Service. Ghana Health Service. Speaker, we can't always be waiting on the politicians. And oftentimes we lazily put the blame at the politicians. We have dedicated public service, public health service, people who are paid by the taxpayers' money. There must be a way that the Ghana Health Service should come and explain to us. Is it the case that we are lacking vaccines? Is it the case that they never knew about this? They are sleeping on the job? What is happening? They must come and give us some reasons. And we can make the argument that, well, we should wait for the minister to be sworn in, but I would differ. The leadership of the Ghana Health Service should come and tell us why this matter is as where it is. In this time and age, we can't be allowing such basic ailment to be taking lives. So necessarily, the Ghana Health Service must go to the aid of the poor people at the Upper West. Otherwise, the matter will get out of hand. To that end, I want to pray you that you allow or you direct the Ghana Health Service to come and brief this House.
But in his directive, First Deputy Speaker Bernard Ahiafo, who presided in the absence of the Speaker, directed the Ghana Health Service to take immediate remedial action, including setting up a public health fund to deal with the outbreak.
Consequently, I will direct that the statement be referred to the Ghana Ministry of Health. Ministry of Health is to take immediate action to create awareness, conduct contact tracing, intensify the provision of medical care to the affected victim, and consider the establishment of the Public Health Emergency Fund. yes, I so direct.
Well, let's expand this further. We've been joined by Dr. Fred Adumaku-Boati, the Ashanti Regional Director of Health. And thank you for joining us. We'll also be joined a little later by Isaac Ampoma, his Executive Director, Concerned Health Education Projects, former representative of Ghana's NGOs in health. Both of them have joined me. But I'll start with the Director for the Regional Health. And I'm concerned really because, and not just me, the whole country is concerned because normally it would be that areas with very dry weather that will be recording the CSM. How has it trickled down to the Ashanti region already?
Thank you for giving us the opportunity to share what we are experiencing in Ashanti region. When we engaged the media on the 4th of February with the main purpose of raising the awareness, currently Ashanti region, as we speak, we have not recorded any case of meningitis, and then we don't really have any death. But I think when we engage the public, we gave the statistics for the past 3 years. And then, as you rightly said, that 2022, the cases that we recorded were 20, no death. 2023, we recorded 18 cases with 1 death. And that, as you said, 2024, we recorded 42 cases with 1 death. Then the case fatality was 2.3. And as we speak now, we have not recorded any case. There are a lot of reasons why we tend to have cases and at times mortality, and I think that's the reason why you have given us the forum to discuss. And that's basically what we have started doing. Most of the time we lump meningitis together for want of better word. We have different germs that causes, as we know, we know cerebrospinal meningitis, CSM commonly known. There are 3 different main bacteria which are the offending agents. Notwithstanding, it's really difficult by looking at the presentation of the case, that's the signs and symptoms, to be able to tell whether this meningitis is caused by either germ A, germ B, germ 3, and more so when the mode of transmission is basically the same. So it's important, as we always do as a service, we have weekly surveillance that we do. And the idea is to pick cases and make sure which one is in question when we have this presentation, and especially when we have the season, when we are in the season, because a lot of risk factors come into play to cause this problem. Unknown to many people, when we are talking about outbreak or cases, the way the Ghana Health Service, globally, WHO, all of us will say there is an outbreak is different. We have what we call the alert threshold, and we have epidemic threshold, and these are based on the population in which cases are really coming from. But for us, the most important thing that we will have to talk about now is that what are some of the signs and symptoms people present, so that the awareness is created and we pick them well. Because even depending on the kind of germ which is causing it, our response and the mortality or morbidity, the deaths, can be different. There are a lot of reasons. Or even looking at the geographical area or at the ecological zone that you are having this outbreak, the fatality can be different. For us, it's very important that we really mount up awareness so that people know the signs and symptoms. And then, secondly, what we, the health workers, are also doing. So the purpose for us in Ashanti region is to heighten the awareness. I can't remember the last outbreak we got in Ashanti region was 2015, 2016, which in fact was actually the whole country. So we are naive. In terms, when I say we are naive, we are not exposed to most of these germs as compared to our brothers in other places, where at times it might be endemic. So that the way that we are going to feel the brand is different from others. So it's important that, look, we spread the message very wide and far. And then the mechanism that we have to put in place for people to pick it is early. I mean, now because we are now in the season, the climatic conditions, there are three main conditions that come together to increase the outbreak. One of them is climatic condition. When it's dry, as we are seeing, stormy dust, the low humidity, all these come together to cause break in the coastal, in the nose and the tooth.
Doc, I will stay with you, and especially because you would need to educate people on this very situation and this disease. But I'm quite concerned between 2022 all through to 2023, it will look as though it is about 100% increase in the cases, which usually, if you were concerned about CSM in the country, you'd be looking up north. And so you have said that people are not educated on it, but what do you think has caused the increase in that amount, especially because we're in 2025, and if we have not recorded any case in the Ashanti region, that's good to know. But in 2022, 2023, 2024, that's 100% increase. What do you think caused it?
So basically, it's still to do with the climatic conditions.
Okay.
And then because you know, and that will also help us in education. Whether you have a lot of cases or not depends on the type of the germ which is causing the meningitis. Right. Basically, at least if we listen to, I think, Honorable Titus view, there are main three bacteria that are involved when it comes to this fatal meningitis that we talk about. That the strep pneumo, Haemophilus influenza type B, and Neisseria meningitidis. All these can cause, and I don't want us to go into those terms, all these can cause meningitis. But it's not all of them that really have the potential to cause a lot of spread, what we term as outbreak.
Okay.
And we don't really use, as I said, we don't really use cases to say an outbreak. So if these cases, maybe where they are coming from, you know, Ashanti region is about more than 5 million population, 43 districts. And then if you look at one district, the number of cases over that population will even determine whether, for want of better word, allow me to say whether you are in the alert threshold or what we call epidemic threshold. We don't use cases per se to determine whether we have an outbreak. But the most important and interesting thing is that though the cases were 42 in 2024, we had only one death. And the one death, we are not saying is good, no, but I think what we did, what made us to really prevent people from dying, because at the end of the day, if you're able to pick the cases so early, you can be 100. But if you are able to pick them so early, then you will reduce morbidity and mortality, especially if they are drugs to be given, especially if you know the germ which is causing this particular outbreak, we have vaccines for them. So for us, the surveillance is so important for us to be able to pick what is there and then fight against it. If you ask me as a consultant for public health, I will tell you I'm not afraid if you pick the cases early. No, but it's our management of the case. For me, that is so important, because whether you like it or not, if the cases, and lots of people don't know, now, in this season, we can say that in some areas, in some part of the country, you can have the offending agent germ being endemic in people. They can be endemic in people, endemic in the sense that as we are speaking, you let me see, I'm harboring one of the germ when I'm not presenting in any signs and symptoms. Right. You know, I have developed kind of some immunity for that. It's okay, but when the weather changes, because there is a covering, you know, I'm well hydrated, there's no break in any part of my mucosa, that's the covering my nose. I don't have any break, no upper respiratory tract infection, no dusty causing a break. Then it means that I'm able to contain it, one, I'm not able to pass it on. But when the weather changes straight away, and then it means that I can come with the disease now, I can even also spread it to other people who then become vulnerable. The question is, do these people already have a form of immunity? Okay. The important thing. Okay. So even depending on the kind of the area, particular one which is the agent at that particular season, it's not a clear-cut case. And I think that's what we as a service, we are always into and then making sure. But unknown to a lot of people, every Monday we have cases and ask what number of cases of meningitis did we record in any of the districts, so that we do all these and we manage it.
Okay.
When the clinicians are very aware, they heighten awareness. Then for us it's very good. So they easily take cases, we take them to, we have public reference lab, and that we are able to test.
Okay.
But for now, let's talk about how we'll be able to protect ourselves, pick more cases, and so that we don't have more deaths.
That excites me very much. I'll come back to you, but let me take a moment and go to Isaac Ampoma, who is Executive Director for Concerned Health Education Project. And so, Isaac, let me know if you have done some work on this particularly, or you've actually seen the data and what Doc is just saying about meningitis. Let me hear your first comments on that. Unfortunately, it looks like my network is not going to be favoring, but whilst I get Isaac to be able to sort the network out, I'll come back to you, Doc. So let's start. What shall I be looking out for, especially now that the weather, I don't have control over the weather. Doc, what shall I be looking out for? What should I know and what should I do?
The intense headache. You should know once uncommon headache that really you are not aware, you are not used to. That's one of the things that you look at. Fever, and to surprise you that the things that I'm going to mention, they are just like malaria. And for this one, the difference in this is what we call photophobia, when they are not able to look at any form of light. But even at that time, you are going to the terminal stage, people become unusually very weak. They might even vomit. And then the one that we knew when we were kids, like the neck rigidity, neck stiffness, that is difficult even to do this. But normally you don't want to wait there. But you would then ask me about, these are some of the common things that we have been seeing with malaria.
You are in my thoughts. You are in my thoughts, exactly. Yeah.
Yeah, so these are the common things. So what makes it very different? But here for us is the season. It's the season in which we are in now. And then at times you kind of have cold, flu. You know that common cold flu. People are coughing and all these. In the children, they have a different way of presentation. Okay. But when push comes to show, it's still the same signs and symptoms that we have for malaria and all those. And that is for us as a Ghana Health Service. That's what we mount surveillance and to look at this. And we really even look at our data when we are really conscious. So as a district, as a hospital, if you begin to look at your data and then you see that you have a lot of unusual fever cases, headache and then neck, the attention then should be drawn, and then the focus then should be looking at the conditions that we are in now, very dry, with these nasty storms. That awareness should be there. And here I will tell my colleagues that, look, this is not the time that when you think that somebody is having malaria, you have done your RBT. The malaria test is negative. Please look for other causes of the fever. This person is having cold, and then you have abused antibiotics and all these areas. It's important that we look for all these, because as we just said, look, these signs and symptoms are basically the same, but notwithstanding, there is a particular age group that we should always also look at, between 2 and 29 years. This is age group that are also very vulnerable when it comes to meningitis. So these are things that
to 29 years.
Yes, I mean all of us can get, but the risk group is within that very group, 2 to 29 years.
So you have my attention on that, Doc, because I would have thought that if it's something that my immune system should be strong enough for, then my father, who says he's 76 years, I should be worried about him, because I like to think that his age makes his immune system not very strong. Let me know why that group should really be concerned.
So, I mean, as we said, anytime you have people also have issues with their immunity, if they have different kind of disease, they are immunocompromised. Because at the end of the day, it's your immune system that should be able to fight against it. So, all things being equal, if you are outside that range, for instance, you are able to fight against it. And as you said, extreme of ages, and those particular extreme of ages. Our scare is that they don't mount up with this typical fever headache thing that we are talking about.
Right.
Theirs even is also atypical when it comes to that. So when they come to us, and the key that we really look at during this period is the season, especially from April to October, and that's why this is also taking us unawares. It's from the March there, going there when the weather really has changed drastically, then we begin to see all these especially if it's the one that has a lot of potential for outbreak, the Neisseria meningitis. But as we see, the other forms that really can cause. But for us, the mode of transmission is basically the same, virtually the same.
Which will be?
Which is by people who have the germ when they cough as usual and they cough openly.
Wow.
And instead of them wearing a mask, or if they are so sick, they know they shouldn't come, they cough, and they don't cough even into their elbow. Forgive me, they cough into their hand and come and greet you and me without even practicing the hand hygiene. This person have severe cold, instead of staying at home, will come to work, sit in a car, public transport. And these are ways that is basically droplets from cough, the same way that we get cough. Okay. And so that's why our attention is always on standard precaution. The right way to cough, practicing washing your hands with running water and soap. Look, it's able to abort most of these transmissions that we talk about. Okay. So basically the mode of transmission, say, presentation kind of the same, but the difference is the type of one which is happening, the neck stiffness. Don't wait for that, please.
All right.
All
right, Doc, thank you so much. That's some education over there if you didn't know. We've been talking to Dr. Fred Adomako-Boateng, Ashanti Regional Director of Health, and meningitis is actually at the peak of it, and so you should take care of yourself. Wash your hands with soap and running water. Practice hygiene precautions, okay, and wear nose masks if you think that you're having a flu. But away from that, the President John Dramani Mahama has reiterated his commitment to improving Ghana's road infrastructure, promising to dualise the Winneba Roundabout to CapeCoast Roundabout under the NDC $10 billion Big Push initiative. Speaking at the Jubilee Park in Cape Coast as part of his thank you visit, he stated that the first phase of the project started last year and is ongoing. He says the second phase will focus on dualising the road from the Winneba Roundabout to the Mankasim Roundabout, whilst the third phase will extend the dual carriageway from Mankasim to Cape Coast. Presidential Affairs correspondent Maxwell Agbagba reports from the Cape Coast.
We please stand for the national anthem.
The Big Push initiative aims to drive massive infrastructure development across the country with a particular focus on road networks, bridges, hospitals, and schools. The Winneba Cape Coast Highway is a crucial corridor for trade, tourism, and daily commuting, and its expansion is expected to ease traffic congestion and improve road safety. Addressing the gathering of chiefs, clergy, members of parliament, and political appointees, party supporters, and residents, President Mahama promised to extend the dual carriageway from Winneba to Cape Coast.
Late last year, the contract for the first phase of the dualization of the Kaswa-Winneba Road started. Upon completion, this project will facilitate the movement of goods and services and enhance trade. The second phase of this project will be from Winneba Roundabout to Mankasim Roundabout. And the third phase will be from the Mankasim Roundabout to CapeCoast. While phase 1 is ongoing, phase 2 and phase 3 will be packaged and funded under our Big Push program. We also have targeted important roads like the Yamoransa-Praso Road and then the CapeCoast to Twifo-Praso Road, amongst others.
This week on Desk on Ground, we take you to the University of Ghana, Accra City Campus, where students have been sharing their thoughts on the performance of the Parliament's Appointments Committee. They also weighed in on the appointments made by the President.
Little Nancy.
In Parliament have been quite eventful, from the appointment of ministerial nominees to their vetting, the allegation of bribery levied against the appointment committee, and the chaos that erupted during the vetting process. The appointment committee of the 9th Parliament is definitely one that will go down in history. We're here at the Accra City Campus to gauge the public's perspective on the performance of the appointment committee, as well as get to know what they think about the people that have been appointed by the President, if they are the right ones to lead the nation in the right direction. So have you been following the vetting?
Not that much, but the ones I've watched, they were amazing.
So from what you've watched so far, what are your thoughts on how the appointments committee have carried out their job so far?
I would say they are doing their best, but what just happened with the chaos that happened was bad. It was terrible. It is not good, and it's not something that is exemplified for we the youths to learn from. Before they became honorables, they are grown men, and they know best. Yeah, so they could have handled the situation in a more matured way.
What are your thoughts on how the appointment committee have carried out their job so far?
Well, I think it's not that bad, but in my view, I think their behavior has cemented the kind of perception that Ghanaians have about our legislatures, in that there was this level of unseriousness in them, and that has transformed into whatever that is being done in the name of Ghana. So here in Ghana, seriously, for me, I see our leaders not to be that serious at all, and that has given me a clear indication that my perception, my views on them is so serious, it's so real on the part of our leaders. That's what I can say.
What are some of your views?
Well, a clear example is what the Honorable Minority Leader in the name of Alexander Afenyo-Markins, I think he made a comment somewhere along the vetting that he needs not to be spared of some slot in the army, the police, whatsoever. And that, I'm sure, it's one of the backbone to this kind of level of corruption in this country. Everything is being infiltrated with this level of corruption. In fact, everything is not going well. For you to get a position to serve Mother Ghana, you need to go through somebody. And they are the leaders, they are the propagators of this level of corruption. So I don't believe in them. I don't trust them because of what they do underground.
There have been situations where some of the nominated ministers are vetted for 6 hours and others are being vetted for as little as 8 minutes. And there's been also a situation of bribery allegations. Sure. With all this, do you think that the committee have carried out their job in transparency and fairness?
Okay, to me, what I would say is that whatever they are doing out there, whatever that has manifested so far, I consider this they are setting to be a boondoggle activity. It's a wasteful activity because I know for sure they have cemented and they know what they are doing. For vetting someone for just 8 minutes, maybe it's a candidate of their like. someone coming in to sit for 8 hours is just like maybe they want to roast the person by asking unnecessary questions. They have to ask questions related to competence, what the person have on board that the person can use to what, maybe help the country grow. The policies that the person is having that can streamline the affairs of this country, not necessarily what has gone on in the past, and then some kind of private issues you bring into the public square for everyone to hear. Maybe he's living this kind of lifestyle, this and that. Well, for those ones are very unnecessary.
I'm sure you're aware of the chaos that erupted on Friday night.
Yes.
How do you think this reflects on the legislative?
I believe it is not anything new to us, whereby we see ministers or executives fighting. But one thing that I know is they are people of different status that the entire nation or citizens are learning from. So if even something unpleasant happened during the vetting processes, then it is up to them to act in a more appropriate way.
It's such a disgrace to the government, because the people in parliament are elders, are people we look up to. So if the leaders are doing, how much more the youth? Because I feel what happened in this school, Accra Academy, it's also some of them look up to those things. It's the same thing, like the way they were, taking cutlasses and other things, killing people with cutlasses. They are looking this. There are people, there are students who need to be, rebuked. But because the seniors are also, the elders are doing it, I don't think there's something that needs to go on. There has to be some kind of discipline. They have to be called to law. Yeah. And I remember recently something happened in Parliament when the daughter of the late Rawlings